Your arteries are silently clogging, and your yearly checkup is giving you a false sense of security. If you've been told your cholesterol, your blood pressure is normal, you might think you're safe. But there's the truth. Most standard tests won't catch plaque buildup until it's too late. Welcome to another Visser podcast. Cardiovascular disease doesn't just lead to heart attacks. It accelerates cognitive decline, fatigue, erectile dysfunction, poor circulation, long before you can feel the symptoms. Plaque buildup doesn't happen overnight. It's a 20-year process, all right? So why aren't we getting this in these 20 years? Your yearly checkups are not hitting the mark, and we can. Most medical checkups don't even attempt to detect it early. Today, we're going to break down conventional tests fail and which tests you actually need, how arterial plaque develops silently and what it fuels. Next week in part 2, I'll show you how to reverse and prevent plaque with lifestyle and targeted interventions without blindly relying on your statins. If you want to extend your health span and keep your arteries clean for life, this is your episode. You know, cardiovascular disease is the #1 killer globally. Why your yearly checkup isn't enough to detect it? If it's building for 20 plus years before you get your first heart attack or stroke. Basic lipid panels measure the wrong things. LDL, HDL levels alone don't tell you whether you have dangerous atherosclerotic particles floating around, like ApoB. Or it doesn't tell you about your genetics, Lp(a), which were never measured. Total cholesterol isn't a good predictor of risk. What matters isn't just how much cholesterol you have, but how it's being carried in the blood. Okay, it's that protein that it connects to be able to carry to the blood, right? It's that LDL. Is it the small LDL? Is it the large LDL? What is it? That's what we need to find out. Blood pressure checks are more reactive. Hypertension is a late-stage symptom, not an early warning sign. Does that mean you shouldn't check your blood pressure? No, you should check your blood pressure all the time, every day. You can have plaque for decades before your blood pressure starts creeping up. No imaging or plaque detection until it's too late. Most doctors don't order a coronary artery calcium scan, CAC score, which shows plaque before symptoms appear. A 0 score means you are good for the next 10 years. A 1% chance of an event, all right? And that you should have after the age of 40, you should take these tests. If it is not 0, then you should move on to the next step, which is asking for a CT angiogram. This goes deeper and looks at the different types of plaques close up in the arteries, in the heart. This is really your best test. But guess what? It's expensive. So let's first understand some key factors that drive the plaque building. 1, your genetics. And yes, there's a test for this. Small LDL particles in your blood that can lodge to the arterial walls. 3, inflammation, critical to getting those small LDLs lodged in the arterial walls. 4, insulin resistance, causing endothelial dysfunction, the cells of your artery walls. Endothelials are the cells of your artery walls. Insulin causes dysfunction here. With dysfunction, inflammation, then you get these little particles. You're starting to look at a whole heap of trouble. Most people with cardiovascular disease have metabolic dysfunction, so we have to look at this. And finally, is the plaque in your arteries rupture prone? And are you prone to clotting, causing a heart attack or stroke? This is what we need to look at. So our tests are going to be focused on this. And they're going to be the most reliable and the most state-of-the-art tests that we have up to now. Okay? These tests actually you need. And you ask, why don't I get them? Well, that comes back to the cost-benefit analysis done by governments, insurance companies, all either managing their budget or keeping their healthy ROI. So these next tests might have to come out of your pocket unless you have or already had a devastating incident. Okay, so what tests do you need, right? Start off, ApoB. You need this test. This measures the total number of atherogenic particles, LDL, VLDL, okay? And it's a far better predictor of heart disease. You need triglycerides tested. You need Lp(a) test. Remember I talked to you about the first one being genetics? Lp(a) is a genetic inherited risk factor that drives aggressive plaque formation and clotting. You test this once, okay? If it's positive, test the rest of the kids, test your family. And then your physician knows they have to be super aggressive in your treatment or your prevention. We need to keep those LDL levels at around 50. But if it's 0, you're done. You never have to test it again because that number is not going to change. So, CAC, Coronary Artery Calcium score. Okay, it's a CT scan. It's done quickly. It quantifies actual plaque buildup in the arteries and predicts a heart attack risk for the next 5 to 10 years. Okay, taking it after age 40. If it's not 0, then move on to what we talked about, the CT angiogram, showing all the dangerous soft plaque. It is expensive and you'll have some radiation exposure due to the contrast, but it's the best test we have right now to really look in these arteries in your heart and see the plaque. See if there's hard plaque, soft plaque, because the soft plaque is the dangerous one. That can pop like a pimple and it's over. You got a heart attack, you got a stroke. Okay, so that's soft, mushy plaque. That's super dangerous. So we need to look at that. And this really, with a CT angiogram, that's where we get in close and we really see what's going on. The scarring inside the arteries, everything. It's like 3D going around the heart and the arteries and looking really inside. Okay, next we need to know inflammatory labs. We told you about inflammation being one of the big drivers, right? So the first test is HCCRP. It's a systemic inflammation marker. Next, fibrogen and IL-6, indicators of clotting risk and immune activity. Okay, so we need to know if you're going to clot. Okay, LP, LPA2, and MPO, markers for an unstable rupture-prone plaque. Dangerous. Okay, here's the most important one. LPIR score, insulin resistance. For the most important one, needs to be less than 25. It indicates insulin resistance and arterial disease. Okay, and high LPIR means your insulin resistance, even if your fasting glucose is normal. So we're looking at fasting glucose, we're looking at fasting insulin, but it could still throw us off. The LPIR is conclusive. Okay, so insulin resistance causes endothelial dysfunction, oxidative stress, and promotes arterial plaque formation. People with high LPIR have more oxidized LDL and small dense LDL particles, which penetrates arterial walls way easy. Why does this matter for people with normal cholesterol? And why is it my number one? Most important. Well, many doctors dismiss cardiovascular risk if LDL is normal, but a high LPIR score means LDL is still likely to be dangerous. 80% of people with cardiovascular disease have metabolic dysfunction. LPIR reveals it before it's too late. That's why it's that important. Most doctors don't check A1c unless you're already diabetic. A1c is crucial because even normal blood sugar fluctuations below the diabetic threshold can drive arterial damage. Okay, so we need to test it. A1c of 5.7% to 6.4% is the pre-diabetic range. Increased cardiovascular risk is significant. Optimal range should be between 5.2 and 5.4%. That's ideal. Okay? If your doctor isn't ordering these tests, you are playing Russian roulette with your cardiovascular health. So just one last thing here. Remember we talked about the CAC score, okay? That's the calcium test. It's just a quick CT scan. It's not that expensive and it's quick, easy to do. And what they're looking at here is really some calcium buildup in your arteries. If you have calcium buildup, if you're not zero, you have some calcium buildup, it could be two things. One, well, you already have a problem, okay? There is atherosclerosis going on in your arteries, okay? We know there's this plaque buildup, okay? The calcium just gives us an indication. It doesn't tell us how much really, it doesn't tell us what type of plaque you've developed. And so we need to look further into that. But it could also mean that you're on statins, okay? And one of the things that statins will do is basically harden those arteries and calcify those arteries so you can't have ruptures or you have less ruptures, okay? Ruptures meaning it's like a pimple, okay? Like a pimple, and when you press it, the pus comes out. Well, that will clot up, and that will go to your heart, give you a heart attack, or go to your brains and give you a stroke. Okay, so if it's soft, if it's hard, it's very hard to press a pimple, right, and make it pop. But if it's soft, it has a soft side. The softness is in there. That, you know, those cells are like all mushy and it's like muddy, and that's easy, right? That's dangerous. So that's what we're trying to avoid there. So statins will do that. Now, the thing on statins is, and the reason I want to go further in the next thing on statins and everything else is, if we look at statins in itself, a patient that's 5 years on statins, and this is research backed, will gain, how much do you think? How much time would a drug like statin taken for 5 years, right, that protects you, gain you in lifespan? Means how much longer will you live? Well, it's been tested. It's 4 days. Just 4 days. So do we need to do something else? Do we need to do different things? Do we need to do this plus plus plus? Yes. Yes. In the next episode, that's what we're going to go over. Okay? So stay tuned. Now, I'll have the tests that you need to take in the description. So you know what to go for. You have the list. This is what you need to demand, even if you have to pay for it yourself. Trust me. Now, I know your physician for his reasons, your insurance companies for their reasons, or your government, if you're Canadian or Dutch or European, for their reasons, won't let you have these tests right off the bat, right? It's too much money. But talking as someone who's looking at his own health and talking to you, and I know you want better health and you want to do what's good for you and your family, take these tests. Until next time, subscribe, ring the bell notification, give me some comments, and share with your friends. Thank you.